Hi friends, I am Saurabh Padak. Today I am going to tell you about aplastic anemia. Before I proceed to aplastic anemia, I want to convey a message that I have also made Hindi version of this topic, aplastic anemia. So those friends who are interested in Hindi can also watch Hindi version of this topic, aplastic anemia. Now let's proceed to aplastic anemia. What is anemia? Anemia is defined as decrease in hemoglobin, hematocrit or red cell mass for that particular age, sex and physiological state. Remember, value of hemoglobin varies with age, sex and physiological state. Anemia is of three types: anemia due to blood loss, hemolytic anemia, hypoproliferative anemia. Anemia due to blood loss is of two types: acute blood loss, chronic blood loss. Example of acute blood loss is road traffic accident. Example of chronic blood loss, GI malignancy, gastrointestinal malignancy. Hemolytic anemia is caused by excessive destruction of red blood cells. Hemolytic anemia is caused by excessive destruction of red blood cells. Example of hypoproliferative anemia are aplastic anemia, iron deficiency anemia, pure red cell aplasia, megaloblastic anemia. Let's discuss in detail about aplastic anemia. There is a term aplasia. Aplasia means generalized bone marrow suppression characterized by decreased hemoglobin, decreased TLC, decreased platelets, decreased retic. What is TLC? It is total leukocyte count. TLC is another name for white blood cells, WBCs. Normal range of TLC is 4000 to 11,000 per mm cube. I am repeating once again. Normal range of TLC is 4000 to 11,000 per mm cube. Now let's discuss causes of aplastic anemia. There are two causes of aplastic anemia: inherited, acquired. Example of inherited cause of aplastic anemia is Fanconi's anemia, Fanconi apostrophe S, Fanconi's Anemia, Fanconi's anemia. Acquired causes of aplastic anemia: first, drugs, second, radiation, third, bone marrow suppression, fourth, some viruses can also cause aplastic anemia. For example, non-A, non-B virus, Epstein-Barr virus, EPSTEIN, BARRVIRUS, Epstein-Barr virus. Let's discuss about clinical features of aplastic anemia. First, pallor, PALLOR, pallor. Second, fatigue, FATIGUE. Third, increased risk of infections. Fourth, bleeding tendency. What is the cause of pallor and fatigue? Decreased hemoglobin. What is the cause of increased risk of infections? Decreased WBC. What is the cause of bleeding tendency in patients suffering from aplastic anemia? Decreased platelet. Remember one point. There will be no splenomegaly in patients suffering from aplastic anemia. There will be no splenomegaly in patients suffering from aplastic anemia. What is splenomegaly? Splenomegaly is defined as enlargement of spleen. Now let's come to laboratory diagnosis. First, CBC, complete blood count. In CBC, there will be decreased hemoglobin, decreased platelets, decreased retic, decreased hemoglobin, decreased TLC, decreased platelet, decreased retic. In peripheral smear, there will be normocytic, normochromic anemia and pancytopenia. What is pancytopenia? Pancytopenia is defined as decreased cellular elements of blood. For example, decreased RBC, decreased WBCs, decreased platelets. Now what we will do next? We will do bone marrow aspirate. In bone marrow aspirate, we will get dry tap in case of aplastic anemia. If we get dry tap, then we will do bone marrow biopsy. BIOPSY, bone marrow biopsy. Bone marrow biopsy is the investigation of choice in case of aplastic anemia. Bone marrow biopsy is the investigation of choice in case of aplastic anemia. In bone marrow biopsy, we will get decreased cellularity and increased fat. Now let's discuss severe aplastic anemia. The criteria for severe aplastic anemia is First, bone marrow cellularity less than 25%. Second, corrected retic count less than 1%. Third, absolute neutrophil count less than 500 per microliter cube. Fourth, platelet count less than 20,000 per microliter cube. Let's discuss very severe aplastic anemia. The criteria for very severe aplastic anemia is: first, bone marrow cellularity less than 25%. Second, corrected retic count less than 1%. Third, absolute neutrophil count less than 200 per microliter cube. Fourth, platelet count less than 20,000 per microliter cube. The difference between severe aplastic anemia and very severe aplastic anemia is that in case of severe aplastic anemia, absolute neutrophil count will be less than 500 per microliter cube, while in very severe aplastic anemia, absolute neutrophil count will be less than 200 per microliter cube. Let's discuss treatment. The ideal treatment of aplastic anemia is stem cell transplantation, but maximum patients cannot undergo stem cell transplantation, so we give drugs like granulocyte, monocyte, colony stimulating factor. I am repeating once again: granulocyte, monocyte, colony stimulating factor, GM-CSF, or anti-thymocyte globulin, ANTI, anti-thymocyte, THYMOCYTE, thymocyte globulin, GLOBULIN, globulin. Eventually, I request everyone to please subscribe my channel. Thank you.